Everyone, we are back for another learning episode of how to best move in your everyday life so that you can preserve your mobility and quality of life for as long as possible. So my friend Chris is back. He's a good sport. He wanted to come back and learn some more. I had some questions about how to sit in a car after what we had gone through, so we're going to do that at his car. But before we go out to the parking lot and do that, I wanted to go over a little bit of about what the body is doing for us and when we have no idea. So so we'll have Chris, we'll have you sit up on this table because it's tall, and then it will have your legs dangling. So I learned long ago that I don't want patients sitting waiting for me on the exam table, which is the usual location that we have patients waiting for the provider, and it is because I find that their back pain gets worse when they sit up there. So let's have you. So this is Chris sitting up here on the table, and exam table, and his legs can't touch the floor. So I explain. Hang on one second. Let me get the skeleton. Okay. All right. Here we go. Okay, here we go. So I explain that here's the pelvis. Hopefully you can see it's really hard sometimes for 3D to see, but we are supposed to sit on these sit bones are called, like on the pelvis. That's a technical term, but you're supposed to sit on those when you sit down. My point to people is that your pelvis is a bowl and that you're balancing on these two spots on the skeleton right here when you sit down. But you're not, so when you sit down, you're not made like a 2x4 within another 2x4 in a jointed kind of robotic way or wooden toy way. You're made like a doll, like a life-size doll. If we put a life-size doll of Chris up here and he sat like this with the weight of his legs, the weight that it would be in real life, Chris should slide off this table, right? Like, why doesn't he slide off the table with his legs hanging as if he's sitting on some bleachers or a high wall? So what I want Chris to do is to feel like right here, his back muscles on each side of his spine, like above his pelvis right here. So right here, and feel the texture on them right here, and even feel the texture on each side of his spine so that he can see it right up here by his neck and feel the texture. And he's got to remember that. Okay, got to remember that. All right, so wait right here. So I'm going to get a chair, and then we're going to have him. So now we have Chris sitting in a chair, and this is what I encourage all my patients to do when they're sitting in chairs. Make sure their feet are flat on the floor so that the floor is fully supporting the weight of your legs. So now in this position, try again to feel the texture of your muscles in your low back and the texture of your muscles on each side of your neck. So I'm putting all my eggs in one basket here, but usually people will say the texture is softer than when they were hanging with their legs.
I would concur.
You concur. All right. So why is that? My point to people is that the body, without our knowing it at all times, is working to help us accomplish what we want to do, and we completely take it for granted. That when we're standing and we just stand all our weight on one leg and barely put weight on the other leg, all of these muscles are all working, all in your hips, to keep you on balance, when really if you were just a doll also, you should fall over. So, and you can keep that up for a certain amount of time in your life, but eventually I say to people that gravity spares no one, and eventually you will have to pay. And then I try to help people work their way backwards out of the problem. Okay, so when we go to the car, then it's with this principle in mind, that when you're sitting in a car and it puts you in a place that's really not helping you be in a straight line against gravity because of the nature of one size fits all on these bucket seats, etc., then it sets you up to get to have cumulative kind of tension and problems later. And then people will say that they can't drive longer than 30 minutes or 2 hours without suffering a lot when they get out of the car. All right, so let's go to the car and see what we can work out for Chris. All right. Okay. So we're now down here at the car. I'm sorry about the traffic noise, but there's no way to move the car up to my office. So, okay. So you might be wondering why I'm standing here with this roll towel and this socket wrench. So these are my attempts to bring to life the concepts that I'm trying to teach about. Okay. So when we sit in a car with a bucket seat, these cars and couches and almost all the chairs, they're all set up for people to tilt their pelvis backward and then have the back of the chair leaning back. People will say, oh, that feels comfortable. But what that really is doing is when you tilt your pelvis backwards. So this is shortening your hamstrings and the connective tissue underneath here. So when it shortens all of that, and this is what I had told Chris about in his video, this gets all shortened, then you take your normal stride, and then you're going to pull your butt under more just to be able to equal the stride you've always done. And then this is how people with a posterior tilted pelvis will often have this disappearing butt phenomenon over the years as they lose their butt. So the reason the socket wrench is here is because what's happening is when you sit in the seat with this posterior pelvis and then leaning backward, this leaning backward will give you a little bit of contraction like through here. So you're going to be contracted, and if your seat is far away, you're going to have, then your thigh will be fully extended, and this is a contracted position for your thigh muscles. How do you kind of remember that? Well, back in the day when you were wearing jeans and you took them out of the dryer and there's no spandex in the jeans back then, we put on our jeans like this, straight on the bed, and then you'd have to do all these exercises, and what was the most uncomfortable thing was to squat in your jeans to stretch them out in the thigh and in the butt. So when you're driving and you tilt back, like under and back, and then a fully extended leg and drive like this, then you keep contracting your calf while you do the accelerator. So I brought the socket wrench because what you're doing every time then, your glutes are a little contracted and your thigh muscles are all contracted, and on top of that, contracting your calf. So this over time is like this socket wrench phenomenon I tell people that is like cranking down how tight you are all through here. So no wonder when people get up out of the car, they struggle a lot and feel terrible, especially the longer the drive is. So we're gonna have position Chris in the car so that before I already went over how to like sit down and get in the car, so we won't go over that. This is just more like how can Chris position himself so that if he is on a long drive, or a good habit even when it's not a long drive, so that he is not progressively contracting all of his muscles all around his thigh pelvis area to eventually develop sciatica pain or similar problems later. Okay? All right, so ready? Let's have you go on ahead and sit down in here, and Talia, I don't know if you have to get closer, whatever, when we're doing like this. So this presents a problem that, so I'm counseling patients all the time about how to sit, and a lot of them will say that their legs are too long or they're too big for the space they have in the car. So I haven't seen Chris sit in his car yet, so this will present some real-time difficulties about how I can try to help him best position himself for driving. Okay, so let's see how you use, so like I said, so what happens is that these seats, see how it positions him like tilting backwards right here, so this already tilts him backwards, and then these seats, these are bucket seats. So the bucket seat is to accommodate one size fits all, and the headrest on these seats are pitched forward to help support the head and neck, of course in the event of like a crash. So this puts people in this position of leaning backward when they're driving. I brought this roll towel because you could use a pillow or this towel to try to make up for that distance in the back so that you aren't pitched as far backward in the seat. So let's see if we can get this for Chris. So we can put this, and you're going to put it around your mid back, right around here. So let's have, right around here. Yeah, so then this sets him, and then you're going to try to sit the seat up a little bit. Like it's, you have it reclined, don't you? So try to make it, which one makes it sit, like a little bit forward, So part of the reason you might do that is because this pushes your head forward because they pitch them all that way. You see what I mean? So let me see if I can move this up for you a little bit like that. Does that help you so that it doesn't make your head go forward? You might need a little bit. Yeah, you might need a bigger This has quite a tilt. Is this tilted? Did you tilt that? Like, does that pump so that it tilts you back versus forward?
I think so.
Can you make it so it's not tilting you as far backward? Does it come up this way?
Is it moving forward? Feels like
How does that thing work? Does it?
Yeah.
Does it look like it's lifting up? Do you feel like it's lifting up? Yes, it is. I think it is lifting up, so it's not as tilted far back. Yes, that's good. So when you do that, then you might not need this as far forward as you have the seat. Do you see what I mean? So now, okay, so he's adjusted it so his seat is not pitching him back as far. Do you see what, right?
Yes.
Is that as far back? And then now, how's that?
Better.
Is it better? You still feel like your head is forward, don't you?
No.
This is really extreme how much they put that forward. Yeah, look at that. Maybe can you go back a little bit on make your seat recline here more. Just the seat part. Yeah, like a little bit more. There. So
There.
when you do that, then how's that?
Okay.
It's better, right? Because I want you to be able to relax, because there's no holding yourself in this position. You want to be able to relax in this position. So what I like about this is that Chris's knee is partly bent as opposed to like being almost completely straight. And then this way I know that he's stretching his thigh, and that it's basically got pre-stretch going on. So when he operates the accelerator and cranks down and makes his calf muscle tighten, that it's not making the whole system as tight as could possibly be. So this is better. And then if you can see, can you move the camera this way? So what we've done is that we have tried to elevate this a little bit so that he is not as at a posterior tilt as much as he was, because it was really aimed backward here. So he changed it so it's less, and then we put a little towel. He can get a pillow, or I took a rolled hand towel and put that here and made his seat a little more vertical, so that he now his torso, because we want this pelvis and his torso to be closer to a right angle, and that helps you in the long term for surviving a long car ride. All right, very good. So I'd say that's it for a longer-legged person in a smaller car, and we're gonna try what it looks like when a shorter person is in a car, and what kind of challenges it presents there. Thank you. All right, so here we are with Bella. She had the incredible idea to move so we don't get as much traffic noise. So hats off to Bella for that great idea. Thinking on your feet. Okay, so let's see what kind of position Bella is in when she's driving. And even though Bella's only 18, we're just going to set her up for success so that when she's 58, she can still handle a long drive. Okay, ready? You want to get in the car, and then we'll see what your usual position is for driving.
I don't lean all the way back.
You don't.
Ever.
So this seat is tilted backwards. So what
Yes.
do you do?
So I like the fact that when it's tilted back like this, it feels good on my lower back.
Yes.
But I never lean all the way back. So
Okay.
I'm always driving like this.
Oh, okay. So that's good, because that's kind of good for all the muscles in here, but that means that you're holding on and doing a lot of like extra work against gravity. And so what we did with Chris, which you didn't see, but my point is that when we're doing stuff like that and you're holding, you have no idea how much work all these muscles are statically doing for you, and we're taking it for granted. So let's see if we can help you. Maybe this will come in very handy then. In my car, I found instead of using this rolled hand towel, I started using a really flat pillow. So I went to a store, bought like 10 pillows, put them all in my car, and tried to find the flattest one or the size that worked the best. So these are things that you can do. I've also suggested that you can always try to carry a jacket with you when you go somewhere where you think that something like that will happen, when it's like maybe not as socially acceptable to bring like a lame looking pillow or a blanket. And so you could try to bring an extra jacket and fold it. Just whatever little bit will get the job done. I'm just trying to give you ideas. Okay, so that's great that you do that. So she already drives with her knee a little bit bent so that her thigh is somewhat stretched. This, again, do you see that this tilts her pelvis backwards, this way this bucket seat goes? And is that seat able to be adjusted? Like, can you make the bucket part at the back go up more, or is it already adjusted as high as this?
Oh no,
Oh,
wrong
wrong one.
This one.
Yes.
That
like,
one just goes like forward.
oh, it
This
only
go
makes you
up.
go forward. Nothing
Yeah,
makes
like,
you.
I guess it moves like the whole seat.
Oh,
a
it
little bit
doesn't
forward
tilt
and
the
a little
ankle.
bit up,
Okay, all
but
right.
it
So yeah. So was that comfortable? Do you need to push it back the way it was because it like elevated you? Yeah. Feel right around there. Okay, so let's put this. So we'll try and put this right about here.
Yeah.
And then it's still leaning you back. So can you make your seat go forward a little bit? The back of your seat.
That one?
Yeah. Make it go up a little. Yes. Right about there. So can you tell that now you don't have to hold yourself up as much as you were doing it before? Like, can you relax in this position?
Yeah, I can relax.
Yeah. And whereas before you were like, you'd hold yourself. Would you hold yourself here?
Yeah, normally I put my butt
Right,
super
all the
far
way.
back,
Yes,
and
good
then
for
I
you.
go like this.
And then you go like that. Okay, so let's see if you can. Yeah, so still keep your butt back like that, but see if you can relax like this. That's good, right? When you're leaning back too much in these bucket seats, you actually strain your neck, your chest, your arms, your shoulder. It just puts all of them under constant contraction strain. Okay, wonderful. There wasn't too much to fix, but just that little bit will make a big difference in the long run.
There you go.
All right. Thank
Thank
you, Bella.